Imagine for a moment searching for a distinct place within the world. The harder you search for the space to connect, the tougher and more puzzling it becomes. Those around you just don't seem to appreciate your reality, nor provide you with the pleasure or the companionship you so crave and desire. You feel utterly alone, with an overwhelming sense of core suffering and misery. You withdraw into yourself. It's as if you've lost your humanity in the unseeing eyes of those who constantly just look straight through you. Now envisage searching desperately for feelings that represent carefree times that you just know were once part of your existence, but never quite managing to relive those joyous feelings again. You sit in the chair in your room, alone, feeling overpoweringly miserable, frustrated, anxious, and afraid. You have panic attacks, and people just become annoyed when you try to communicate your unhappiness by your actions. You feel so disheartened, you cry a lot because you do not feel your life has any meaning anymore. Worthlessness intimidates you constantly and continually. This research project emerged out of a thesis as part of a Masters in Health Science program at Victoria University, Melbourne. This published case study examined the use of doll therapy as a therapeutic tool in reducing change behaviour in a person living with dementia, while specifically associating this with Bowlby's theory on past attachment needs. The aims of this research were to examine the impact of the provision of a lifelike baby doll as a therapeutic tool, reduce and/or prevent change behaviour associated with observed attachment needs, improve life quality and support, stimulate meaningful communication and social interaction, promote well-being as opposed to ill-being, and to dispel the negativity and subjective myths that suggest dolls used as an individualised intervention are wrong, disrespectful, and/or demeaning. This single case study consisted of a three-phase research process. Phase 1, pre-introduction of the doll. To meet the study's inclusion criteria, the participant required a documented diagnosis of moderately advanced Alzheimer's disease and presented with displayed change behaviour believed to be related to her search for attachment needs. Quantitative data included the use of a coded behavioural tool developed specifically to evaluate anxiety-related behaviour linked to attachment. For the purposes of this paper, the data was grouped under three logical categories: physical, emotional, and psychosocial behaviour. Phase 2, introduction of the doll. The doll was presented as a gift to the participant in the privacy of her bedroom. The participant of the research had not been verbally interactive for quite some time, and when she was gifted the doll, she looked up at me and said very clearly, "This is what makes life beautiful." Oh my God, my staff and I were bawling like babies, and that experience in the moment was quite significant to the results of the entire study. Phase 3, post-introduction of the doll. Following the quite momentous introduction of the doll, the Phase 1 process was repeated again over a period of 1 week. Following Phases 1 and 2, qualitative analysis of the field notes and quantitative descriptive statistics compared behaviour pre- and post-introduction of the doll. As you can see, the results demonstrated that doll therapy was a very positive intervention for this participant because there was substantial reduction in change behaviour related to the need for attachment. Despite so much controversy on this topic, the end results and findings were more than encouraging and successfully demonstrated a huge reduction of change behaviour, meeting of attachment needs, stimulation of the nurturing instinct, retention of personhood, improved interaction and maintenance of relationships, meeting of biopsychosocial and emotional needs, provision of comfort, peace, and a sense of control, resolution and prevention of depressive symptoms, improved physical condition and independence, and conversion of ill-being to well-being. This study proved that when utilised as an individualised encounter for a specific reason, the provision of a doll for this lady not only significantly reduced change behaviour and dramatically improved her quality of life, but demonstrated extensive, unexpected, and quite fabulous ongoing improvements to many facets of her life experience overall. In conclusion, this research supports doll therapy as a therapeutic intervention that may be utilised in the ongoing care of some people with dementia to reduce change behaviour specifically related to attachment needs. It also extends an understanding of the use of complementary therapies to inform professional practice, to encourage opportunities for the exchange of knowledge and stimulate research and best practice. Such an outcome may contribute to an improved quality of life, growth and fulfilment in the maintenance of personhood. As professionals, we need to build upon this evidence to promote therapeutic interventions that demonstrate another valuable way forward in the provision of person-centred dementia care.